All right, guys, so this is going to be a short and sweet version of the hygiene lecture. Um, we are going to watch this video about Florence Nightingale next week. This is where we got all of the ideas for all of our cleanliness practices because Florence likes to be clean, right? So we'll get into that a bit next week. All right, so as far as skin is concerned, this is one of the ways our body is protected from bacteria and from the environment around us. And my dogs are going nuts. So pause this real quick. All right, so the skin. This is how our body is protected from the outside elements, right? So it helps to protect us from the environment, it helps to protect us from bacteria. The main thing with this is whatever standard you hold yourself to, the patient must be the same. If they are dirty, we want to clean it. If they're smelly, you want to fix it. We want to be caring for our patients. This is an opportunity to help give for you to give them some dignity that they might not normally have. As far as the mouth, this is a cavity that is lined with mucous membranes. These are rapidly dividing cells, very at risk for the potential to have skin openings. And whenever there's an opening in the mouth, this is a direct way that things are absorbed into the bloodstream. As far as our personal hygiene, this is a way that we can assess things very passively, right? So, this is what we are looking out for while we're doing other things. We are noticing that they are dirty when we're doing our head to toe assessment, when we're doing our initial assessment of the patient, our initial screenings. Again, if they're dirty, we want to clean them. Our goal as nurses is to improve their well being and to leave them better than we found them. We want to make them do as much as possible. They should be doing as much of the hygiene as they can. We are just there to fill in the gaps. We absolutely need to keep an eye out for the implants. Those can be points of infection. They can also be points of areas that bacteria can hang out and hide and not get cleaned regularly and then get into the generalized system. This is an example of a shotgun to the face. And really what we're thinking here are how do we clean this person up? Before we can even start to clean her, before we can even start to examine her oral cavity and do any type of cleaning, we have to assess for whether or not she is neurologically intact. We always need to make sure our patient is neurologically intact before we perform hygiene. So anytime there's a neurological or a head injury, so shoulders and up, we need to assess for whether or not they are intact prior to performing, especially oral hygiene. So, testing for the gag reflex. All you have to do is touch the back of the throat, the back of the pharynx, with a Q-tip or with a tongue blade. That's it. You just have to lightly tap it, and if so, they are going to make this face. That's how we know they have a gag present. So, our patient absolutely has to have a gag reflex. This lets us know that they can protect their own airway. If we are providing oral hygiene to a patient with neurological deficits, we have to assess the safety of the airway before we put fluids in there. So this is how we assess it, and then we can provide oral hygiene after we have done this for our patient. Keep in mind that it is very vulnerable to have hygiene performed on you. Patients feel very sensitive and very vulnerable when we are doing this. We want to be cautious and careful not to cause psychological damage when we are cleaning the patient. There's a very fine line between assault and assessment, right? If we are doing assessments, we're using the backs of our hands. We're being gentle with the patient. We want to make sure that we are being very gentle with them. They may also have some body image disturbances, like our patient with the foot wound that we talked about yesterday in the infection management lecture. That patient might have a lot of body image deficits and problems that we have to be sensitive of. Again, we want to make sure we're not increasing psychological damage when we're providing hygiene for our patient. There are many cultural variabilities that can come into play as far as different practice and different hygiene rituals. One example of this is many times it is very uncomfortable for people to get baths from the opposite gender, right? That's something that a lot of cultures can be very sensitive to. we want to make sure that we are paying attention to developmental stages as well. When patients are elderly, they may have new physiological limitations and they can't reach parts of their body that they're used to. Maybe they are having some pain when they are trying to access that, and it's affecting their ability to perform their own hygiene. And toddlers is another example of this. They are interacting with their world and getting gross and starting getting gross all the time and exploring their world. They're also starting to be able to follow directions. So we want to teach them hand hygiene and self-care. We start to teach them to do this after going to the bathroom and then before and after meals. And then anytime they're around their, little friends and they're playing, we want them to make sure that they're washing hands. As far as personal hygiene, we do want to take into account any possible issues for the future. So maybe they are having some chemotherapy. Again, our chemotherapy patients, this is a death of the rapidly reproducing cells. So think oral membranes are going to be very at risk. Their GI tract is going to be very at risk for wounds and sores. So high potential for infections. So we really need to make sure we're doing adequate oral hygiene. We want to know what their actual capabilities are. Part of how we can tell this is what the patient is actually cleaning versus what they're not cleaning. It's going to tell you a lot about what their capabilities are. Maybe our stroke patient with a unilateral deficit, they're able to clean one side of the body and not the other. Our diabetic patient, maybe they're not paying attention to their feet, which we'll talk about in a little while. There are many cultural considerations that we have to take into place. Religions can absolutely be a factor in terms of their cleaning practices and what they will and won't do in terms of how they take care of their body. Our objective data is clean, dry, and intact. That's what we want it to be. Surgery is the same but different. We'll talk a little bit about that in a moment in terms of how we bathe surgery patients. So some nursing diagnoses, we want our patients to be doing as much as possible. We are here to help, but only with deficits. We are not giving bed baths just because they don't feel like getting in the shower. They can get up and get to the shower. But if they do have a self-care deficit with bathing, that's when we step in and we are helping out with that situation. Remember that we need to be using empathy to help reduce their anxiety and promote their comfort. This is a time that can be very anxiety producing for the patient. We want to let them know what we are doing. We want to have them prepare to do as much as possible, right? If they are bedbound, bring over the bedside tray to them. Give them the washcloths to wash their peri area. They can actually do that for you. You don't have to do that if they're capable of doing that. Bring them the basin so that they can be brushing their own teeth. And they can be performing as much hygiene and as independently as possible. Our infection management, so as far as solutions and independent versus dependent nursing interventions, there really aren't any dependent nursing interventions that have to do with hygiene. Really, this is all nursing right here. This is all independent nursing diagnoses. We can do all of this stuff. We don't need a physician order to tell us, hey, give a weekly shower, right? That's something that we can just do on our own without needing to be told to do that thing. We also need to pay attention to basic body positions and whether or not our patient is safe. We would not want to be performing oral care to an unconscious patient in a supine position. Sit them up a bit, so put them into a reclined position, right? Turn them to the side so that we can make sure that we are getting all the things out of their mouth. Make sure that we are actually suctioning things back out of their airway so it's not going back down. Pay attention to what is actually safe for your patient. When we talk about the GIGU, we will learn all about the Sims position. If you think about anything that has to do with the rectal, think about Sims position. As far as our taking action, I want you to click on this link in your PowerPoint, which I just realized you don't. Yeah, I should have uploaded the PowerPoint. I want you to take a look at this video and pay attention to the bathing and personal hygiene. This is how to do a bed bath. This is, I want you to watch this so you can see what is expected. It is a very specific procedure. Make sure you're always cleaning from cleanest to dirtiest. This is why we start in the upper arms and go to the fingers. We clean the face and then the groin, never the opposite. In surgical, we do clean a little bit differently. We are going to use CHG wipes. We are also going to use those in the ICU settings. This is not unnaturally occurring things. These are a chemical. We do have to make sure the patient doesn't have allergies before we actually use the CHG wipes on their full body. So test a certain area of their skin before you do the rest of their body. It can actually cause a first or second degree chemical burns if the patient does have an allergy present. Okay, and before we resume, I just wanted to let you know where to find the videos I'm talking about. If you go over here to course materials, and then you scroll down to this book site, Elsevier, Harry Potter clinical skills, and then click on this link. And then that is going to pull up your Elsevier videos. 17.1 is the one I was talking about with the bathing and personal hygiene. So you're definitely going to want to take a look at that for the bed bath, especially if you've never done one before. All right, so this is, there it is. All right, so this is talking about oral hygiene. Oral hygiene is absolutely a big deal. It can cause respiratory infections and pneumonia. If we have intubated patient and we have that tube that is going down in their airway and it has an infection, this is going to lead to pneumonia. If we have a foreign body in the foreign tube, right, a tube going somewhere in the body that they weren't born with, this is an infection risk. If there is a tube going into their body that they weren't born with, clean it. Make sure you clean it from the insertion site away from the body and to help pull that infection away from the body. With heart disease, the blood goes from the mouth to the heart. If we have poor oral hygiene and we cause tissue damage, bacteria can enter the bloodstream and settle in the heart. This is called infective endocarditis. It actually settles on the heart valves and requires surgical replacement of the heart valves themselves. With our uncontrolled diabetic patients, these patients have peripheral neuropathy. They can get extremely bad wounds and have no idea that they are even present because they don't feel them. I have seen and treated patients with exceedingly awful foot wounds, and they had no idea for months and months that they even had a break in the skin, much less a massive infection. So our surgery patients, as far as CHG wipes, we are going to use all 6 wipes. We are going to use them in the follow of the order. We're going to start with the neck, shoulders, and chest. That'll be one cloth. The next one will be both arms, hams, the web spaces, and axilla. So all the arm things. Cloth 3 is going to be abdomen and then the peri and groin area. Cloth 4 will be the right leg and the right foot, as well as web spaces. 5 will be left. And then 6 will be the back of the neck, the back, and then the buttocks is going to be the very last place we clean prior to going to surgery. Again, make sure you are assessing for allergies prior to cleaning their entire body. Taking action. So we absolutely have to take off the shoes and socks and assess them. We always have to look at the patient's feet. This is a patient who has diabetic neuropathy and had no idea he had a foot wound in his toe. He just had no clue because they can't see their feet. They never take off their shoes and they can't feel it. This other picture is a picture of of maceration. So this is exposure to excessive moisture. Macerated skin tissue is extremely fragile and very, very prone to damage. We need to dry out the feet, right? We need to make sure that we are taking off the socks, taking off the shoes, assessing them, doing good foot care, and actually allowing it to dry. We also have very high risk patients in our diabetic patients. They are extremely high risk because of the potential for diabetic neuropathy. Our unconscious patients, we often forget about, as well as our NPO and surgery patients. These ones are the ones who are really overlooked, are the patients who are not getting anything by mouth. Maybe they have an G tube, maybe they're intubated. The thing is, we forget to do oral care. We think that just because they can have nothing by mouth, that means we can't do oral care, and that's just not the case. We actually need to make sure that we are cleaning their mouths. We can do little oral swabs and swab the insides of the mouth, brush their teeth, and then just make sure that you're suctioning back out all of the fluids so that they're not aspirating anything. We also need to assess for any type of foreign bodies and implant devices. So this is going to be our dentures, hearing aids. Make sure that they are not sleeping in these devices and that they're taking them out routinely to clean them. They can trap bacteria in the mouth or in the ears. If you don't know how to clean it, ask the family, right? Because they've been doing this for a lot longer than you have. So it's absolutely appropriate to ask the patient what they normally do to clean the device. However, this is not your, trach patient who takes the trach out of his esophagus, licks it, and stick it back in. That patient, we might want to actually teach them how to do proper trach care. Shaving patients, we always need to assess the bleeding risk. If they have a potential for bleeding, we want to be very cautious with this. We would want to make sure that we are using an electrical razor to shave a patient who has any potential bleeding risk. Don't be this guy. All right, so evaluating, we absolutely want to be paying attention to hygiene. This is the type of thing that we need to be doing in terms of evaluating whether or not they are at deficits and paying attention to how well they are able to perform their own hygiene. However, if they are able to do this, we want to promote independence. They should be doing absolutely as much as possible for themselves. Make sure that they have their call light so that they can call you for help if they need help to perform hygiene, right? And that's really all I have for you today. Make sure you take a look at the videos if you haven't already, and I will see you on Monday.